Nephrologist Dr. Randy Chen and Rory Pace, a medical nutrition expert and registered dietitian, join me today to discuss the launch of New Day, which provides individualized nutrition diagnostic and counseling services to people living with chronic conditions, including CKD. It's great to have you here this morning. I will start out with a logical question, which is, what is medical nutrition therapy, or MNT, and how is it different from more traditional or general nutrition counseling?
Medical nutrition therapy really is focused on helping people to treat, manage, or maybe even prevent chronic or acute illness or possible complications of chronic or acute illness. So it's probably what people think about when they think of the work done by a registered dietitian, counseling that's applied to a particular condition.
We know that diabetes is the number one cause of chronic kidney disease and dialysis in the world, as well as high blood pressure, which is also influenced by dietary choices. And so when we talk about managing chronic kidney disease, you can't talk about that without having dietary intervention. It's really one of the key components of care. As a physician, we're there as advisors, but when it comes to healthcare, that is really dependent upon what the patient will do and the medical advice that they will adhere to. And dietary therapy and nutrition therapy is one of the most important things that a patient can do for themselves. You need a good resource and coach in order to continue on that pathway towards health.
I see. So New Day provides individualized MNT coaching to improve outcomes. Is this something covered by insurance plans?
Medical nutrition therapy has been a covered benefit for beneficiaries of Medicare for a number of years, and of course, other insurance providers have followed suit. Part of the reason for that is that there is evidence that medical nutrition therapy improves outcomes and saves healthcare dollars. The estimate approach $8 to $14 of savings for every dollar invested in medical nutrition therapy provided by a registered dietitian. And this can be savings in physician time, in medication utilization or medication cost, but a really important contributor to that savings is reduced hospitalization. So we know hospitalization costs money, but it also tends to worsen outcomes for patients, for individuals. There's a real opportunity here. And as Dr. Chen pointed out, the two major causes of chronic kidney disease, diabetes and hypertension, have nutrition and lifestyle interventions or roots. Right there, there's a huge opportunity to intervene and improve outcomes for this patient population. We've also seen some research in the last several years that show reduced mortality in the first year in dialysis when there is care provided by a registered dietitian prior to starting dialysis.
We've previously focused mostly on dialysis patients in terms of our resources of registered dietitians, but really it starts way before that. And I think this is really providing a service that has not been met previously. The number one question I get from patients is, how can I change my diet to improve my kidney function or slow progression of kidney disease? And honestly, I don't have the knowledge base that my colleagues in nutrition have, nor do I have the time and ability to form that relationship where they trust my knowledge and advice in terms of dietary. I can do the medical therapy in terms of other comorbid and disease management, but I really need and sorely am lacking currently the ability to use dietary and nutrition therapy. And so New Day and the therapy and counseling that can be done, as well as relationship building, is really, really important to me.
One of the important opportunities that I see here in launching New Day is exactly about that relationship and that trust. We do, as dietitians, develop relationships with patients over time, working with them in dialysis, and hope we'll have the opportunity to do the same as we work with people with chronic kidney disease. But the other relationship that we develop over time that's really important is with our nephrologists, like Dr. Chen. And so far, we've had those relationships, nephrologist and dietitian, but there's been an unmet need with this CKD population. We have nephrologists who have come to understand, appreciate, value, and trust our expertise as dietitians working in nephrology, and have often, at least I have over my career, received inquiries, hopeful inquiries from nephrologists with whom I have worked, hoping that I might be able to help them with their CKD patients. But, sadly, we've not been able to do that because we didn't have the right venue, the right structure to be able to do that. And so here through New Day, we hope to meet that need, being trusted partners with our nephrologists in the communities we serve to ultimately take care of their patients.
Let's talk about the services that New Day offers to patients of Dr. Chen's and other nephrologists. Please, walk me through what a patient might experience with New Day MNT counseling.
Patients or clients coming to New Day will have the opportunity to work one-on-one with a registered dietitian to receive a full assessment, not only of their kidney disease and related conditions, the rest of their medical condition, medications, their food intake, what they eat, not just what it is, kind of the why it is, right? What are their food preferences? What are their cultural eating patterns, traditional eating patterns, boundaries or barriers to adequate food intake, or with food preparation, support at home, the many, many factors that influence what we eat and thereby our overall health. That assessment then leads into goal planning in conjunction with the patient or client, focusing on what the patient or client wants to achieve and how to get there, assessing and identifying barriers to meeting those goals, and then putting in place resources or tools to help overcome those barriers. It may engage the family or caregivers or other supporters to ensure continued success and growth. The other thing that's different is that we really do focus on that behavior change and understand that it's incremental and that any progress is good progress. And that it's not necessarily about just reaching a specific goal, but making progress in the direction of that goal.
Dr. Chen, how will New Day's medical nutrition therapy services be worked into your practice, especially with people with pre-dialysis CKD or chronic kidney disease?
Yes, of course. I've always been an advocate for dietary and nutrition education and counseling. I'm looking forward to it immensely because it's something that's so lacking. And really, it's something that the patients want. We have to provide services that the patients want and need and that they will benefit from. And I've seen it in my practice with the small bit of counseling I have done in terms of nutrition therapy with the knowledge base I have, and it has impacted. But to have a registered dietitian whose main goal is to provide ongoing therapy, that's a game changer. And I think that it's sorely needed, and it just makes medicine that much more exciting and the care of patients with kidney disease that much more hopeful.
My goal is to make this easy for our nephrologist partners. So medical nutrition therapy does require a physician referral for Medicare beneficiaries. And in California, medical nutrition therapy requires a physician referral regardless of payer. So I have developed a referral form that's specific for kidney disease to make it easy for doctors like Dr. Chen to refer patients, supplying the information that we need to get those patients started and begin that partnership and that journey.
How do New Day MNT services play into the larger picture of the shift to value-based care?
Disease is just not episodic and it's a one and done. It's over several years and lifetime. And you have to provide value throughout the course of disease. And so I think that this shift in paradigm in terms of thinking of episodic care and providing value through time and as a team approach with the patient, providers, and dietitians in this type of therapy, that's the only recipe for success.
Yes, and so some of this new initiative and policies, there is a goal to get more people to transplant earlier in their disease, right, prior to starting dialysis. And so this may be a place where New Day can be of help and support. If we're able to work with people in earlier stages of CKD and help them be healthy and prepared for transplant so that hopefully more of them can get to transplant without needing to go on dialysis. We also can support people post-transplant. There's so many potential complications that can arise after a kidney transplant that have nutrition, lifestyle aspects to them or to their management. So cardiovascular disease, high cholesterol, diabetes, whether it's aggravation of existing diabetes or even a new onset of diabetes after transplant. These are all things that we can manage and support with medical nutrition therapy. And Medicare does cover this service for the first 3 years after kidney transplant.
From all that you've said, at the end of the day, New Day MNT is really about quality of life.
While it's important to talk about outcomes, and we so often focus on clinical outcomes, it's equally important to focus on the outcomes that are meaningful to the patient or to the client.
The lifestyle issues.
Right. Is that having greater functional capacity and being able to walk further, feeling better to participate in family activities and achieve important milestones in their lives. For some, it's weight loss. For others, it's not. It might be seeing the hemoglobin A1C level come down, fewer diabetes complications, blood pressure, Dr. Chen mentioned.
Or playing with the kids or the grandkids and not feeling exhausted. Simple stuff.
Yep, exactly.
This emphasis on medical nutrition and how it fits into the overall care plan is a perfect alignment between the nephrologist and expert dietitian working together to provide individual care to people living with kidney disease.
Right. They trust me to take care of their medical issues, but they always ask, Doctor, what can I do about my diet? And that's the question that I honestly, and this is not an exaggeration, it's the number one question I get from patients. And I'm frustrated because I can't give the adequate registered dietitian knowledge that is necessary, nor can I spend most of my visit talking about that, even though the patient would like to talk about that primarily is the dietary issues.
Yeah. New Day wants to be that easy button for you, that resource, that expert resource with the knowledge and also the opportunity to spend that time and develop that relationship. And one of the really important pieces of medical nutrition therapy is not just education, but it's really working with people to identify their goals and their barriers to achieving those goals. So really providing support not only with information, but also with behavior change, understanding how to help an individual be successful with their own health and nutrition related goals to overall hopefully impact their health.
You can learn more about New Day Nutrition by visiting the website newdaynutrition.com. I'm Christopher Springmann, and thank you for joining us on Neph Talk.